Hi, everyone. It's Dr. Kyle Olson back with you today. I wanted to take a couple of videos here and talk to you about one of the more common causes of back pain that we see in the office with a fair amount of regularity, and that's spinal disc issues. Now, this is a term that you may have heard if you know somebody that's had back pain or a major issue in the past. They may have said things like, I slipped a disc, or I herniated a disc, or I bulged a disc. My back went out. These are all different phrases that are essentially talking about the same part of your anatomy. So when we talk about the disc, here's what you need to know about what that disc is and what its function is within your body when it's healthy, when it's moving properly, and when it's doing exactly what it should do. Your disc is a piece of cartilage that exists between each set of bones in your back, each set of vertebrae. So between each one, there's a disc there all throughout your spine, and it does one of four major things. It helps to provide shape along with the muscles and helps to stabilize your spine. It acts like a cushion or a shock absorber between the spine as well. So whenever you're doing any motion, including sitting, standing, walking around, you're creating a force of gravity on your spine. Your disc is in between that, and it acts like a shock absorber to take some of the pressure off of that. It also helps to pump fluid in and out through your spinal cord by simply moving your disc, by moving around against gravity, by walking, by moving. It's helping to push fluid through your spinal cord, which helps keep your brain and your spinal cord healthy. It's also there because it offers some space for the nerve to come out from your spinal cord, travel out to your body, so it can get the signal out to your body to tell every part, every cell, muscle, organ, and tissue to function properly. So you can see a model of what this looks like. I'm going to hold up here. This is a spinal model. The disc is this material between the bones right here. And you can see it's at each one of these. Now, down here on this side on the red, this is an example of a herniated or bulged disc. That's when the fluid on the inside actually pockets out and hits into the nerve, causing pain or other symptoms. Now, there's two things to know about the shape of the disc, or the foundation of the disc. There's two parts. The first part is the outside rim. This is actually a hard, almost cartilage. It's called the annulus pulposus. On the inside, there's actually a very soft gel-like consistency. That's the nucleus pulposus. I'm sorry, the annulus fibrosus is the hard outer part. The inside is the nucleus pulposus. Think of like a toothpaste type gel. And just like if you were to hold a stress cushion, if you were to squeeze one side of your disc, it's going to push that fluid or that gel to the other side. Now, here's where injuries happen. When your spine is properly aligned, that fluid is pushed toward the front of the disc, away from the nerves, away from the muscles, everything in the back that it needs to be there to protect. It offers space without actually interfering with their function. When you have a spine that's out of alignment, when you have an injury that starts to knock off the movement between those bones, that disc is going to start to wear down. And when it starts to wear down, a couple things can happen. Number one, it starts to just break away and break off. That's called degenerative disc disease. This is something that's picked up on x-rays. A lot of people that have back pain experience this, or it's caught via an x-ray when they go to their doctor. This takes years to get to that point, and most people won't even feel pain until it's at least 10 years or more into this process. It's a slow breakdown. The other type of injury is more that herniation or a bulge. And what happens there is the hard outer fibers become weak over time, and the gel gets pushed into that area, and it starts to pocket out. And when it pockets out or bulges out, it can hit a spinal nerve that's coming off of there. And that's where your body sends a pain signal that says, hey, you need to pay attention to this. And I can tell you, after dealing with thousands of patients with this type of pain, those are some of the more painful experiences that people have described to me. Those are the people that oftentimes they're lifting something, they hear a pop, and they can't get off the floor for a while. Or they all of a sudden feel a sharp shooting burning down their leg. That's when your body is screaming out, this needs to be corrected because it's affecting the nervous system itself. This is one of the more common presentations for this. Now, because it affects the nerves and the nerve root from the spine, not only is there pain for patients, but many people also experience things like numbness or tingling. They'll have burning sensations. Some patients will feel like they have no muscle strength, like they can't lift their leg, they can't kick their foot. They lose the control through that body because the pressure on that nerve is so severe. If left unchecked, this kind of injury can actually lead to back surgery, and this is where most spinal fusions or spinal, where they cut away part of the bone to relieve pressure on it, is. So this is not something to take lightly. If you experience some of those symptoms and you suspect you have a disc issue, please have it evaluated by a chiropractor to evaluate if that's something that's there and what it can be done to correct that. Most of the time, these injuries, unless they're from a severe trauma, in which case an immediate procedure might be necessary at a medical facility, these are over time type of injuries that can be addressed with proper motion, proper movement, and taking pressure off of the disc to allow them to heal and function properly. So this is the couple things I want you to know about the disc. First of all, it's got two major parts, the inside and the outside. When the outside breaks down, the inside starts to bulge out and it hits the nerve. The second is that it has four major functions, including strength and stability, shock absorption, and allowing space for your nerve to function. When those start to break down over time, that's where you start to get pain. If you think you have a disc issue, or you know somebody that may have a disc issue as well, please have them evaluated by a professional, make sure the function of their nervous system and pain can be managed properly as well. I'm going to tune in, I should say, in the future. We have some more videos coming about treatment for spinal issues, how they're picked up on imaging, some of the more things to look for. So it's going to be a big talk about this because it's such a pressing issue in the way that we stress our bodies nowadays. Have a wonderful day, everyone. I can't wait to see you again next time. Have a good one, good day, and good health.